1 in 8 U.S. women will develop invasive breast cancer over her lifetime. Those numbers are big. They're even bigger if you've been personally impacted with breast cancer in some way. And so as Breast Cancer Awareness Month comes to a close, we wanted to talk about the risk factors and ways to decrease that risk. So essential. Dr. Teresa Baker and Dr. Mary Grace Bridges join us today from Texas Tech University Health Sciences Center. Ladies, thanks for being here. This is such an important topic and very timely for sure. And that number does seem pretty tough, right?
It's a big number. It's sort of likened to prostate cancer now. If you live long enough and you're a woman, your likelihood of being diagnosed with breast cancer is very high. 1 in 8 is a big number. And most of the time it's picked up in a routine OB/GYN exam, or the woman herself feels a lump. And there are some things that we can't modify. I mean, you can't modify your gender, you can't modify your age, but there are some things that we can do to decrease risk, and we thought we'd talk about those today.
Well, I think that's really hopeful, right? There are things that we can do to impact it. So what's the first thing? Breastfeeding is the first thing, right?
That's right. Every month that a woman nurses, her risk of breast cancer decreases. So we really encourage women for the child, but also for the mom. Her chance of getting breast cancer goes down, and nothing else can modify it to that degree.
Really interesting. Let's talk about weight management then, too. That's an important risk factor that we can take care of.
Mm-hmm. Yeah, so definitely eating a healthy diet, maintaining a healthy weight. Those are things that a lot of women can do to prevent their risk of breast cancer in the future.
What else can we kind of target as far as manageable things goes?
Definitely alcohol intake. Smoking can increase your risk of breast cancer also. And so, you know, everything in modesty. So recommendation is to limit alcohol drinking to one or less a day.
Okay, now in the notes there's a really big, long word. Tell me about chemoprophylaxis, right? Is that the right, did I say it correctly?
Yes.
Okay, what does that mean?
So chemoprophylaxis is essentially a drug that you can take that for high-risk women, so anyone who with a lifetime risk of greater than 20%, which is calculated based on, you know, family history of breast cancer. There's certain drugs that they can take to theoretically decrease those women's risk of getting breast cancer in the future.
So when do you need to get a screening like that? When do you know that it's time and that it's actually a legitimate thing that you need to look at?
So we recommend screening for breast cancer with mammograms starting at the age of 40. But in some women who have a close relative, like a sister or mother, who may have been diagnosed at a young age, then the recommendation is to start 10 years prior to when their relative was diagnosed.
Wow. Okay. Well, so that's definitely something. As we all do get older, and as with their, you know, breast cancer becomes more prevalent, that's definitely something to keep in mind for sure. What's that screening like? Is it challenging? I mean, what are we talking about here?
The genetic screening?
Yeah.
No, it's just a blood draw.
Just an easy blood draw.
I think Mary Grace and I were talking about this earlier, and it's the psychology of this is interesting. What we really try to get women to do is to just look it in the eye, because there's a lot of things we can do if they'll come and talk to us, and if, you know, early detection, chemoprophylaxis, but sometimes we tend to hide, even when we know we're at risk of breast cancer or whatever, and we just hope that we can get the message across that if you'll come in, there are things we can do to help.
Absolutely. I mean, that, and really, knowing is part, you can't control it, right? But if you know, that's part of, you can kind of control the outcome a little bit, right?
You bet.
Very good. Okay, where can we get more information from you girls and things like that?
It'll be on the Infant Risk website, but also you can, what's the site for the breast cancer?
Breast Center of Excellence.
Okay, we'll look it up for sure. Guys, thank you so much.
Thank you for having me.
Thank you very much.
Important stuff for sure. Always a pleasure to talk to y'all. Y'all, Dr. Baker delivered a baby today, and she's here. Anyway, coming up. He didn't deliver a baby, but he does know a lot about trees. And we don't have a ton of trees in our area, but the ones we do have a long history. When we come back, we're going to talk about some of those common trees in the Panhandle. Stick around.